4 dangerous vitamins you should never take, and 4 you should be taking daily if you're over 65. What if I told you that the vitamins you swallow every morning could be the very thing killing you slowly? According to JMA, seniors taking the wrong supplements have up to a 40% higher risk of early death. This isn't clickbait, it's clinical data. One vitamin on this list has been linked to brain shrinkage, another increases your risk of stroke, nerve damage, and heart failure, even at normal doses. And you're probably taking it every day. After 65, your liver slows down, your kidneys can't flush out excess as before, your nerves become more fragile. Yet these vitamins build up, poison your cells, and mimic symptoms you chalk up to aging. But it's not aging, it's preventable. In this video, we'll expose the 4 vitamins you should never take after 65 and the 4 you should start taking daily. Stay until the end, because vitamin number 1 is associated with a 36% reduction in all-cause mortality, according to a major European study. Before we start, let me know. We'll also discuss current guidelines from health organizations, including seniors' specific nutritional needs, potential drug interactions, and how to assess possible deficiencies through lab tests. By making informed choices, you can reduce risks and maximize the benefits of safe, effective vitamin support. Let us know where you're watching from, but first we need to talk about the bad vitamins, starting with one that might seem harmless but can cause serious, silent damage over time in older adults. Number 4, vitamin A in the form of retinol. Vitamin A seems like a hero. It supports your vision, immune system, and even skin health. But the truth is that for those over 65, especially those taking multivitamins or liver-based supplements, excess vitamin A, specifically as retinol, can build up in the body and lead to toxic overload. What many don't realize is that vitamin A is fat-soluble. This means the body stores it in the liver and fatty tissues, instead of excreting it like water-soluble vitamins. And as we age, our liver slows and fat stores shift, so the vitamin A you take today doesn't go away. It accumulates. Over time, this buildup becomes toxic and triggers subtle symptoms like dry skin, dizziness, blurred vision, and joint pain. You might think it's just aging, but it could be chronic vitamin A toxicity, especially if you're consuming more than 2,000 to 3,000 micrograms per day in supplements. It gets worse. A 2022 review in the European Journal of Clinical Nutrition linked excessive vitamin A intake in seniors to a 25% increase in atrial fibrillation risk, a heart rhythm disorder that drastically raises stroke risk after 65. If you're over 65 and still taking a supplement containing retinol or retinol palmitate, it's time to reconsider. Your body does need vitamin A, but not in that form. Instead, opt for provitamin A sources like beta-carotene from colorful fruits and vegetables, carrots, sweet potatoes, squash, which your body converts only as needed, reducing overload risk. Consult a doctor or dietitian to check your levels via blood tests and safely adjust your dosage. You'll get plenty of beta-carotene from foods like sweet potatoes, carrots, spinach, and eggs, where it's present in a safer form that your body regulates more effectively. Unlike retinol, your body converts beta-carotene into vitamin A only as needed, reducing the chance of excess to almost zero. If your multivitamin still includes retinol, check the label. Any amount over 700 micrograms per day for women or 900 for men can be dangerous, especially with prolonged use. The safest option is to eliminate the synthetic version entirely and rely on natural, whole food sources. That was your first warning. Get ready for vitamin number 3, which is even riskier and often recommended to seniors without prior testing. Number 3, iron supplements. Iron is essential, But for older adults, iron supplements can become a silent, gradual threat. If you're over 65 and still taking iron just in case, it may be doing far more harm than good. Most people associate iron with fighting fatigue. Doctors prescribe it for anemia, and it's often added to senior-focused multivitamins, promising to combat tiredness or brittle nails. The little-known truth is that after 65, your body stops losing iron as it once did, and this mineral doesn't disappear. It accumulates. Unlike water-soluble nutrients, iron is stored mainly in the liver, heart, and pancreas. Over time, excess iron promotes oxidative stress. When unstable molecules damage cells, inflame tissues, and age organs from within, it also intensifies the formation of lipoperoxides, harmful compounds linked to Alzheimer's, cancer, and heart disease. To avoid this risk, opt for balanced dietary iron sources like beans, lentils, and lean meats, and have your ferritin levels checked periodically. Only use iron supplements under medical supervision, with dosage and duration tailored to your specific needs. The problem is that very few seniors actually need iron supplementation. Men stop losing iron after puberty, and women after menopause. Unless you have diagnosed iron deficiency or have lost blood due to surgery, ulcers, or chronic illness, you're likely getting enough iron from your diet. Meats, beans, leafy greens, and even fortified cereals naturally supply iron. Adding a supplement on top can imbalance your levels and trigger long-term damage. Excess iron symptoms are easy to overlook: joint pain, fatigue, memory issues, or heart palpitations. They're often diagnosed as normal aging, but behind the scenes, that excess is harming your brain, liver, and heart. Unlike a deficiency, which a doctor can easily correct, high iron levels take time to normalize and damage may already be done. Ready for vitamin number 2? This one is even more common, often taken daily by well-meaning seniors, and it could be draining your bones and muscles without you realizing it. Calcium. The pamphlet at the doctor's office and almost every For Strong Bones multivitamin promote calcium supplementation. But what most people over 65 don't know is that calcium supplements, especially when taken on their own, can increase the risk of heart attacks, strokes, and the dangerous buildup of calcium in the arteries. This isn't fear-mongering, it's science. Calcium is essential, yes, but where it ends up in your body matters more than how much you ingest. When you're young, your bones act like a sponge and absorb calcium quickly, aided by hormones and growth factors. However, after 65, especially in postmenopausal women and older men, this system slows down. Bones stop absorbing efficiently, and excess calcium doesn't vanish. It goes where it doesn't belong: your soft tissues, your joints, and most dangerously, your arteries. Most seniors aren't warned about this. They take calcium thinking it's insurance against fractures, but without proper guidance, the body doesn't direct the mineral correctly. Instead of strengthening bones, it hardens arteries. Instead of protecting you from breaks, it raises stroke risk. To make matters worse, calcium supplements can cause digestive discomfort, like bloating and constipation, and they can reduce absorption of other important minerals such as zinc and iron. And if you're on acid blockers for reflux, a common practice among seniors, your stomach won't absorb calcium properly, leaving you with impaired digestion, no bone benefit, and extra load on your heart. What's the best approach? Get calcium from foods: leafy greens, sardines with bones, yogurt, almonds, and chia seeds. Provide calcium in safer, more bioavailable forms. Your body absorbs and uses calcium from food sources without the risks of excessive supplementation. Number 1, high-dose vitamin B6. This surprises most people. B6 is usually seen as harmless. something you take for energy, nerve support, or to reduce brain fog. It's in dozens of multivitamins and endorsed by doctors. But after 65, high doses of B6 can silently destroy your nervous system, reduce muscle strength, and cause symptoms that look like aging but are actually toxicity. What few realize is that although B6 is water-soluble and seems to be excreted in large amounts, especially as a supplement, it accumulates in nerve tissues and becomes neurotoxic. That means it starts damaging your sensory nerves, causing tingling, numbness, burning in the feet, balance problems, and even muscle weakness. Many seniors with these symptoms are misdiagnosed with diabetic neuropathy or age-related issues, when the real culprit is excess B6. The official maximum limit for vitamin B6 is 100 milligrams per day, but research shows that even 50 milligrams daily over a prolonged period can trigger toxicity in older adults. And many energy boosters, brain pills, and nerve support formulas contain 100% to 250% of that limit in a single dose. Stack that with your multivitamin and fortified foods, and you easily exceed toxic levels without noticing. Once nerve damage begins, recovery is slow, especially in seniors, due to slower metabolism, reduced liver clearance, and pre-existing conditions like diabetes or thyroid dysfunction that already stress the nervous system. So, what's a safe dose? You still need vitamin B6, but in moderation. The recommended daily amount is about 1.5 milligrams for women and 1.7 milligrams for men. Prefer to get B6 from foods like whole grains, bananas, avocado, and sweet potato, rather than concentrated high-dose supplements. And before taking any supplementation, ask your doctor for blood tests to measure B6 levels so you can adjust your dose safely and avoid complications. Number 4, bioavailable magnesium. Magnesium is one of the most neglected yet vital nutrients in aging. After 65, your magnesium stores have likely declined significantly. This happens because with aging, your absorption decreases, your kidneys excrete more, and many common medications like diuretics, acid blockers, and blood pressure drugs deplete your magnesium even faster. The result is fatigue, muscle cramps, poor sleep, anxiety, irregular heartbeats, and even insulin resistance. These symptoms emerge so gradually that they're often mistaken for aging. But when magnesium is restored, seniors report improved sleep, better balance, fewer cramps, and even sharper thinking. Magnesium plays a critical role in over 300 enzymatic systems in the body. It regulates blood pressure, supports nerve and muscle function, and helps stabilize blood sugar. It also maintains a steady heart rhythm and proper brain function. In fact, magnesium deficiency has been directly linked to increased risk of dementia, atrial fibrillation, and even type 2 diabetes. But not all magnesium supplements are effective. Many, such as magnesium oxide, are poorly absorbed and often cause digestive discomfort. The best options for seniors are more bioavailable forms like magnesium glycinate, magnesium citrate, or magnesium malate, which are gentler on the stomach and better absorbed by older bodies. The ideal dose for seniors is about 300 to 400 milligrams per day, preferably split into 2 doses. Take it with meals to enhance absorption and reduce gastrointestinal discomfort. Consult a doctor or dietitian to tailor the dosage to your needs and avoid interactions with other medications, ensuring safe and effective magnesium replenishment. Number 3, vitamin D3. Vitamin D3 isn't just for bones. It's one of the most vital hormones in your body. After age 65, your ability to produce it naturally drops by more than half. This happens because your skin no longer converts sunlight into vitamin D efficiently. And if you spend more time indoors, use sunscreen, or live at higher latitudes, your levels can plummet without you realizing it. The consequences are serious. Low vitamin D3 is linked to fatigue, bone thinning, muscle weakness, low immunity, and a higher risk of infection. What's even more alarming is its association with chronic diseases. In a large 2020 review published in the British medical journal, seniors deficient in vitamin D had a 50% greater risk of respiratory infections and a 30% higher risk of all-cause mortality, including heart disease, diabetes, and certain cancers. Vitamin D3 directly influences how the immune system detects and fights threats by activating defense cells, reducing chronic inflammation, and improving tissue repair. In the brain, vitamin D3 supports memory, cognitive function, and mood stability. Low levels have been strongly linked to depression and an increased risk of dementia in older adults. The problem is that most seniors are deficient, and most multivitamins don't include enough to reverse the deficiency. To optimize your levels, combine D3 supplementation with a diet rich in fatty fish, sun-exposed mushrooms, and egg yolks, and have your 25-hydroxyvitamin D tested annually. Moderate sun exposure, 10 to 20 minutes 3 times a week, also helps maintain adequate levels and protect your overall health. The recommended intake from diet and sun exposure is 600 to 800 IU per day, but studies show most seniors need 1,000 to 2,000 IU daily just to maintain healthy blood levels. If your D3 levels are already low, as often happens in winter, you may need even more, always under medical supervision. The best form to take is cholecalciferol, vitamin D3, not D2, because it's better absorbed, more bioactive, and closest to what your body naturally produces from sunlight. You can find it in liquid, soft gel, or capsule form, and it's best absorbed when taken with meals, especially those containing fat. Number 2, vitamin B12. If you're over 65, there's a good chance your B12 levels are already low without you noticing. Early symptoms are subtle: fatigue, poor memory, tingling in the hands or feet. Over time, B12 deficiency can worsen. It mimics dementia, weakens the legs, impairs balance, and often goes unnoticed until irreversible damage occurs. Vitamin B12 is essential for nerve health, red blood cell formation, and brain function. But as we age, our stomachs produce less acid, which makes it harder to separate B12 from the proteins in meat, eggs, and dairy. Common medications like antacids or metformin further impair absorption. To correct this, ask your doctor for a blood B12 level test and assess whether supplementation is needed. Sublingual, injectable, or intrinsic factor enhanced forms may be more effective in seniors. Additionally, include fortified foods, fish, eggs, and fermented dairy in your diet. With professional guidance, you'll ensure optimal B12 levels, protect your neurological functions, and maintain vitality and balance for much longer. Even if you eat all the right foods, you can still slowly become deficient. And it's not just about memory. B12 deficiency can also cause leg weakness, unsteady gait, and falls as your peripheral nerves begin to malfunction. Many seniors believe it's arthritis or simply aging, but the truth may be something much simpler and reversible. Number 1, omega-3 fatty acids, EPA and DHA. For those over 65, omega-3s are as vital as any nutrient on this list. These essential fats have been studied more than almost any other supplement, and the findings are hard to ignore. Omega-3s protect your brain, heart, joints, and even your longevity. Here's the science. A major 2021 study in the European Journal of Clinical Nutrition followed over 42,000 adults over 60. Those with the highest blood levels of omega-3s had a 36% lower risk of all-cause mortality. That's right. Omega-3s weren't just linked to heart health, but to living longer. Another study in Circulation showed that omega-3 supplementation reduced the risk of fatal heart attacks in seniors by over 45%. Your body needs EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid, to build brain tissue, reduce inflammation, maintain flexible blood vessels, and regulate heart rhythm. Without enough omega-3, seniors are more likely to experience memory loss, arrhythmias, joint pain, and accelerated aging of every organ system. Still, over 68% of Americans over 60 are deficient in omega-3s simply because they don't eat enough fatty fish or don't supplement properly. The best natural sources are cold water fish like salmon, sardines, and mackerel, but food alone often isn't enough to meet the needs of an aging body. That's where high-quality fish oil supplements come in. Look for one that provides at least 1,000 milligrams combined EPA and DHA per day. If you have heart issues or chronic inflammation, you may need 2,000 milligrams or more under medical supervision. Choose a triglyceride form supplement for better absorption, and always verify third-party certifications like IFOS or USP to ensure purity and avoid contaminants such as heavy metals. To further boost effectiveness, pair your omega-3 supplement with antioxidants like vitamin E to protect the fatty acids from oxidation and enhance both cardiovascular and cognitive benefits. Take it with meals, especially those containing fat, to improve absorption and reduce any fishy aftertaste. If you're vegan or allergic to seafood, excellent plant-based omega-3 supplements with algal DHA are available and can help close the gap. Omega-3s aren't just about preventing heart attacks or strokes. They help you think more clearly, move more easily, sleep more deeply, and age more gracefully. They form the structure of your brain and allow your cells to communicate properly. After 65, omega-3s aren't a luxury. They're a necessity to stay sharp, balanced, and strong well into your 70s and beyond. For anyone aiming to stay active and mentally sharp, omega-3s are almost a nutritional insurance policy. They don't just extend your life, they help keep you being you for longer.